Good evening, everyone. My name is Shaquita Renalick. I am the Global Impact Co-Chair for the Kappa Nu Omega chapter of Alpha Kappa Alpha Sorority Incorporated. It is my honor and privilege to introduce our moderator for this evening's event. Our moderator is Mrs. Shanquetta Cunningham. She's the CEO and lead grant strategist of Harris Group and the nonprofit summit of Northeast Arkansas, founder and chairwoman. Shanquetta leads her company on the platforms of social and community impact, maximizing opportunities for others, and intentional leadership. Karis helps nonprofit and for-profit clients develop the intentional strategy, opportunity, and transformation required to succeed in their organizations. Shanquetta is a 2004 honors graduate of Blytheville High School, an alumnus of Arkansas State University, graduating in 2008 with a Bachelor's of Arts in Political Science, and in 2010 with a Master's in Public Administration. Shanquetta is a 2017 graduate of Leadership Jonesboro, Delta Symphony Orchestra, a member of the Family Parental Involvement Committee for her daughter's school, Nettleton Education Foundation. She's a reserve police officer for the Jonesboro Police Department, a 2019 World Woman Fellow, and chapter parliamentarian and connections co-chair of the Kappa Nu Omega chapter of Alpha Kappa Alpha Sorority Incorporated. In January 2018, Shanquetta launched the Over a Cup initiative. This unique initiative is geared towards building connections, providing resources, and empowering minority women-led businesses in the Arkansas and Mid-South areas. Over a Cup is also the only advocacy initiative geared towards this business group in the local area. She is an unapologetic lover of God, family, and equity for all. Shanquetta admits she has 6 favorite people in her life: her wonderful husband of nearly 15 years, her 4 beautiful daughters, and her handsome baby boy. Please welcome Ms. Shanquetta Cunningham.
Thank you. And thank you for having me as a moderator for tonight's important subject. And I have the esteemed honor of introducing our wonderful panelists on tonight. Now, permit me to redact their extensive bios, but we all know that they are phenomenal people in our community. First, I would like to introduce Dr. Brookshield Laurent. Dr. Laurent earned her doctorate in osteopathic medicine from the Rowan School of Osteopathic Medicine and completed her specialty training in family medicine at Christiana Healthcare in Newark, Delaware. Dr. Laurent joined NYT College of Osteopathic Medicine in 2012. She has positively impacted medical education by advancing and developing curricular programs to prepare rising physicians for the current medical landscape and to specifically address health disparities and inequities. Dr. Laurent was appointed to the founding chairwoman for the Department of Clinical Medicine at NYT at Arkansas State University. And as a leader of this institution, she is a driver of innovation and advancement in teaching, professional development, and community engagement that leads to policy, system, and environment change. Our next esteemed panelist is Mr. Dylan Delaney. He's a Northeast Arkansas native. He graduated with a bachelor's in biology from Arkansas State University and earned his doctorate in pharmacy from the University of Tennessee Health Science Center in Memphis. Since the onset of the COVID-19 pandemic, Dr. Delaney has been a community resource for COVID-19 testing and vaccination. Dr. Delaney serves as the Clinical Services Director at Wood Springs Pharmacy and has been a part of the Wood Springs Pharmacy team since 2016. Our last but certainly not least esteemed panelist is Dr. Rajna Rayahin, and he is affectionately known as Dr. Raj. Let me do that again, Dr. Rajna Rayahin. Thank you, Dr. Rajahin, for joining us. And his bio for this evening: he is currently serving as an Assistant Dean of Research and Associate Professor at NYT at Arkansas State University. As a chemist by training, his research program focuses on building novel tests and techniques to discover new chemicals to address health disparities. He is led and has supported various STEAM capacity building and competitiveness enhancement programs. Dr. Raj has worked in a historically Black college. Therefore, it gave him a great insight, and he's highly motivated to get involved in writing grants to increase diversity and inclusion in STEM and establish pipelines to higher education and professional programs. As a faculty leader, Dr. Raj was able to bring people together to initiate, ignite, and catalyze many diversity initiatives. All righty, I got through that somehow, right? Thank you again to our esteemed panelists. And so we are going to get right to it because as you are, I know that I'm excited and I'm definitely ready to hear about the current updates and as much information as we can about the vaccine and to also ease some of our reservations in receiving the vaccine. Dr. Laurent, let's start with you. There was a recent update to the CDC guidelines about quarantine protocol with those who have been fully vaccinated. So at this time, I have two questions for you. One, will you explain the term fully vaccinated? And two, what is the most recent update to quarantine protocol?
So first, before I start, I just want to say thank you for the entire leadership here that has invited me to be here. I'm always excited to have these discussions and chats with our community members. But I do want to preface a few things before I jump into your questions by saying I'm a family medicine doc by training. One of my favorite types of visits when patients come into my office is the preventive care. I love those visits because there's so much I can do before someone gets ill or sick than when someone does become ill. And so my wellness visits are really a lot of check-ins in almost every area of our patients' lives and suggesting, depending on their age, their background, occupation, their gender, sex, what specific preventive services I can provide so that they can attain and live the quality of life that they have. And so before I rather give a preventive measures and provide preventive measures than having to give medications. And I want to say this to say that when I have these preventive visits, it's more than hi, how you're doing and checking in. We're talking about saving lives, time, and money. And even if you don't die from an illness, you're preventing people from morbidities, and a morbidity is having illnesses that changes your quality of life. So I'll just preface to say that I acknowledge the questions, the curiosity, concerns, and reservations around vaccinations in general, but specific to COVID-19. And I am even more passionate to talk about it because of the huge disparities in the severity of the illness and the death that I'm seeing in Black, Indigenous, and people of color community members who are disproportionately being affected by this virus. And because of that, and like many of you who may be interfacing, maybe you're not interfacing with healthcare or interfacing with at least with neighbors and family members, this is very real to me and to many of you. And so it's duly important for me to be able to share, as my esteemed colleagues and panelists here, what information we can. So with that preface, I do want to say that right now we have two main vaccinations in the state of Arkansas, very well known right now in the country. There's the Pfizer and Moderna vaccine. These vaccinations have been studied to show their efficacy after 2 doses, which means their effectiveness after 2 doses. And if you complete 2 doses of each of these vaccines, 2 weeks after your last dose, your body at this time should have been built enough antibodies or proteins to be prepared to take on the virus if it becomes exposed, your body becomes exposed to the SARS-CoV-2 virus, the COVID-19 virus. And so a person is fully vaccinated 2 to 3 weeks after that second dose. So that's just to say that. Now, to your point about the timing and for which we are quarantined, yes, the CDC just this week put out some guidance about whether or not a person needs to be quarantined. And just to give you some context of just words that we're using in the language around COVID-19. Basically, if you've been within 6 feet of somebody, more than 15 feet of someone who has confirmed COVID-19, you are known as a direct contact. And we would recommend these individuals to do is to stay away from the public and other folks, even within their own home, for up to 14 days. Okay. So that's a person in quarantine, and that takes about, and the reason why the 14 days are there is because that's the estimated amount of time to see that if you were exposed and you do become sick, you have up to 14 days to show symptoms. With the new vaccine, the recommendations regarding the vaccine, they are saying now that if you are fully vaccinated after your second dose, right now with Pfizer and Moderna, you do not have to go into quarantine if you are exposed to someone with COVID-19. However, if you do develop symptoms after you were vaccinated, okay, you should go see a healthcare professional to be evaluated just to make sure that you have been infected, because even if you get vaccinated, it doesn't necessarily mean you're not going to get infected. And we don't know 100% sure if you'll transmit that to other folks. So that would be my response to that question. If Dr. Raj or Ms. Delaney have anything to add to that, feel free to do so. I might have taken up their time too. I'll just preface that as well.